Gait belts are a necessary safety device in all patient care facilities. They provide caregivers with the ability to handle patients safely when participating in transfers and ambulating activities. Gait belts allow for a controlled descent of the patient to the floor or support surface. Gait belts also help reduce the risk of caregiver injuries. Medline offers a variety of gait belt options: single patient use, launderable, and wipeable. They are available in pediatric, standard, and bariatric sizes and a range of colors. Before using a gait belt on a patient, you will need to evaluate their mobility level. The patient must have the ability to follow directions, sit up on their own, and steadily support their body weight while standing. Gait belts are not a lifting tool. Once the mobility level has been determined as acceptable, apply the appropriate gait belt. Never place a gait belt over any tubes or lines connected to the patient. For belts with adjustable plastic spring buckles, place the belt around the patient's clothed waist with the buckle open at the front and the seams facing the patient. Thread the tail of the belt through the opening of the buckle. Adjust to desired fit. Firmly press the latch closed to secure. The excess tail of the belt should be folded over and secured between the belt and the patient. For metal buckle application, thread the end of the belt through the open slot with teeth on the hinge side of the buckle. Pass the belt over the teeth and through the toothless slot of the buckle. Adjust to desired fit and secure. The belt should sit around the patient's natural waist. For quick release plastic buckles, place the belt around the patient's clothed waist with the buckle open at the front. Snap together the plastic buckle. To help ensure the proper fit while transitioning from sitting to standing, leave a small loop in the adjustable portion of the buckle. Once the patient is standing, with one hand pull the small loop towards you to quickly adjust the belt, then pull the tail to remove the loop and secure. This allows the caregiver to achieve proper fit without breaking patient contact. The belt should be tight enough that it does not slide down the patient. The caregiver should be able to fit their open hand between the belt and the patient. Always check for skin integrity, proper circulation, and range of motion while using the belt. The excess tail should be folded over and secured between the belt and the patient. Stand slightly behind your patient's weaker side with your hand holding the belt palm side up. Assist with ambulation. If the patient begins to fall, bring yourself close to the patient and use the gait belt to guide the patient to the floor. If patient requires lifting, do not lift the patient manually off the floor with the gait belt. The belt may be left on or removed when the patient is seated. If the belt is left on, make sure it is not too tight and the call light is within reach. The belt should be removed if the patient has returned to bed. Store the gait belt in the patient's room until discharge. Launder the belt after discharge. For more information, please contact your Medline representative.